I was just sharing with participants that we in our scoping work, we're not just interested in data sets, but it's also important to link data sets to the tools used. Of course, in our settings, it's imperative that we understand the burden of mental health problems in the population. It's not always easy to get the screening and management done at health facilities, and therefore the availability of easy to use validated tools that can be employed at the population level is really important. And it helps us really understand not least the burden, but can be a tool that is used for referral for further confirmation and initiation for treatment for those people confirmed to have these conditions. So we have had quite a number of tools, really. Some are widely used and in several settings, several populations, and others are newer, informed by lessons learned or, by new validation studies that have caused their improvements or revisions. And others are being imported from different population groups and being tried in our population settings and things like that. So what we're listing here really are a mix of what has been validated, translated into local languages. And I'm aware that in most African populations, you would see a number of studies, especially cross-sectional, PhD, masters, and some of subpopulation level studies have employed some of these tools. The General Anxiety Disorder GAD-7 tool, the Patient Health Questionnaire. This, I think, extends from PHQ-2, PHQ-7, and PHQ-9. And in most settings, this is actually just used to screen before further assessments are done on the individuals. So it could be that you're doing a population level screening and identifying individuals whose symptoms are consistent with conditions like depression, and then are taken through better diagnostic tools, including psychiatric assessment or clinician assessments. We have other tools like the Strengths and Difficulty Questionnaire, except for the length. But this is one very big tool that has several components and screens for many other conditions. So it's not just one. Unlike PHQ that looks mostly at mood disorders, in this case depression, you have SDQ that has multiple conditions that are reviewed. And others are there, tried, newer, novel, that we may not have listed here, but I'm sure in your research, you perhaps are testing or validating some of these tools, and perhaps you'll be ready to do that. But for purposes of this prize, or for the purposes of research on anxiety, depression, and psychosis, it's important to demonstrate how tools used in the data that you're currently holding have been validated in the setting in which you are, or if you were validated for the first time, what is the performance, the psychometric properties of some of these tools, and how then are your recommendations to improve, or whether you're digitizing them and making improvements in the way digital formats, electronic formats of these tools can be used not just to screen, but to refer or linked to national, databases and things like that. So there's so much that what we have in terms of offering, in terms of tools used at the population level for screening of mental health, can actually offer in the business, or at least in the assignments that the program that we're embarking on. So I just wanted to share some